how to do the Kala Pariksha. What is the significance of Kala Pariksha? How to understand Kala in the present context. These are the topics of discussion in this particular video. Dear ANA community members, press the like button and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching the right information at the right time for the right purpose. Whenever the Kala or time is being discussed, it is being mentioned in the context of Sushruta Samhita. Kalo hi nama Bhagavan Swayambhuh Anadi Madhya Nidhanaha Atra Rasa Vyapat Sampatto Jivita Marane cha Manushyanamayatte स सूक्ष्माम् अपि कलां न लीयत इति कालः संकलयति कालयति वा भूतानि इति कालः. It means Kala is the one which has anadi, that is, which is having no beginning, madhyaha, no middle, and nidhanaha, no end to the Kala. And atra rasa vyapat sampattau jivita maraneja manushyanamayatte. Kala depends upon the rasa sampat as well as rasa vyapat for the proper life as well as the death of an individual. For example, if you are considering an individual having the kapha prakriti, he will be having the madhura rasa intake up to 3 laddus as such in one particular day. Instead, if he is going to consume 6 or 7 laddus, definitely, so that is considered to be responsible for the faster movement towards death. Instead, if he is consuming 3 laddus only, then that is considered to be responsible for the proper maintenance of a life of an individual. In that way, rasa vyapat, proper rasa intake in appropriate proportions. All 6 rasa substances, they are being consumed at appropriate quantities and proportions or percentage, definitely. So that is considered to be the responsible for the maintenance of the health. Otherwise, improper intake of these rasa substances in abnormal proportions, they are leading to the either disease manifestations. If these are in excess quantities, definitely, so that may lead to death. Further, it is being mentioned that sankalete sukadukhyabhyam bhutani yojayati iti kalah athava kalayati mrityu samipam nayati iti va kalah. Further, kala is the two aspect wherein which unites the individuals or living beings with sukha or dukkha. So that is the, if you are consuming a proper diet and a regimen, definitely, so that will be leading to the sukha, that is the proper comfort of an individual, or otherwise dukkha, discomfort of an individual. Whereas the other meaning is kalayati mrityu samipam nayati iti va kala. Because of that, the kala is the one which is taking the individuals towards the death as such. Whereas the context of kala, in the context of the Shadvida Pariksha, it is being mentioned in the context of Dalhana, Kalo Vividho Nityaga Avasthikascha. Nityagaha Rutulakshanaha Avasthiko Dvividaha Swastasya Balyadi Bedhena Vyaditasya Jvararambhadi Kalavasthayacha. In case of the Kala, so that is of 2 categories, Nityaga and Avasthika. Nityaga refers to, that is depending upon the different seasons. Whereas Avasthika, they are again of 2 categories in case of the healthy individuals and in case of the diseased individuals. When you think about the Nityaga or Rutu Lakshana, in the textbooks of Ayurveda, we are going to see 6 different seasons. Vasanta, Grishma, Varsha, Sharad, Hemanta, and Shishira. If you are analyzing these seasons critically, this is actually helpful in predicting the dosha dominance in an individual. Of course, this particular dosha dominance can be analyzed by the quality of exposure of Nidana into the body or quantity of exposure of Nidana into the body, duration of the exposure of Nidana to the body, or depending upon the nature of clinical symptoms observed in the body, we can able to analyze the dosha dominance. So here it is being the image is showing the what do you say that winter season. Whenever there is winter season, naturally, so that will be responsible for the Shita Guna exposure in the body. So here, this particular image shows that the particular individual is having the Shita exposure, cold exposure, particularly in the eyes, in the nose, and in the skin of the face. Hence, we are going to expect the Shita Guna increase very severely in these particular parts, that is eyes, nose, and skin as such. And further, there may be the possibility of Shitaguna exposure on the respiratory system because the nose is having a direct connection with that of the respiratory system. Further, the eyes, so that will be having the exposure specifically related to the eyes as such. Again, it will be having the connection with that of the eyes and paranasal sinuses as such, or the nose or nasal cavity with the nasolacrimal duct, and skin. Definitely it is the integumentary system that will be exposed, that is Shitaguna exposure. So in total, in this particular season, the person will be having the exposure of Vata dosha, exposure of specifically Shita Guna of Vata dosha may be getting increased in the body. In this way, we can able to analyze the Ritu Lakshana and its impact on the dosha. Whereas Avasthika, the term Avasthika refers to Balyadi Avastha. So in case of the thing, so here it is an the what do you say that the age the of or developmental the process of the females, small baby, baby girl, adolescent girl, in this way elderly lady. In this way, so this here we are going to predict the dosha dominance. So here we are going to expect the kapha dosha dominance. So here we may expect the increase of pitta dosha dominance, and here we are going to expect the increase of vata dosha dominance. Further, depending upon the lakshana observed in the body, we are going to predict the dosha dominance. For example, so the lady is having the stick, in the sense, so she may be having the pain in the joint or swelling in the joint as such. In that way, we are going to predict the vata kapha dosha prakopa at that particular time period. In this way, avasthika, so that will be helpful in terms of predicting the dosha dominance in the individuals. Whereas the avasthika in terms of the disease manifestation. So here there are two different time periods. On the day one, the person is developing the manifestation of jwara at around 12 p.m. We know that the 12 p.m. so that will be the natural dosha vitiation of pitta dosha in terms of vayo ahoratri bhuktanam tetamadhyadikaha krama. In this way, based on that particular time, we may predict the pitta dosha prakopa there. And third day at around 10 a.m., we are going to observe the cuff as such, of course. So here we are going to predict the pitta and vata dosha prakopa. Suppose if it is having the whitish color, there may be the possibility of pitta, vata as well as kapha dosha prakopa, that too observed in the pranavaha srotas. In this way, avasthika, in terms of the jvanarambha, we can able to predict the dosha prakopa. When you think about the significance of kala, basically we can able to categorize the significance in three different headings. That is diagnosis of the disease, prognosis of the disease, and planning the accurate line of treatment. When you think about the diagnosis of the disease, depending upon the kala, etc., depending upon the history of the different presenting complaints as such, we may be able to predict the possibility of either vata dominant disease or pitta dominant disease or kapha dominant disease or vata pitta dominant disease or sannipataja disease. We can able to predict. We can able to predict the involvement of either rasa dhatu or rakta dhatu or mamsa dhatu, etc. We are going to predict the involvement of either rasavaha srota subflexion or pranavaha srota subflexion or mamsavaha srota subflexion or astivaha srota subflexion. In that way, we can able to predict the affliction of either jaఠaragni mandya or dhattvagni mandya, etc. We can able to predict. We can able to analyze whether the disease is in the either Vyaktavastha or Bhedavastha, etc. We can able to predict the possibility of the either Bahya Roga Marga affliction or Madhyama Roga Marga affliction or Abhyantara Roga Marga affliction. We can able to predict either the disease is either Ashukari or Chirakari based on the duration or the severity of the presenting complaints. Or we can able to predict the either Alpa dosha or Madhyama dosha or Bahu dosha avastha of the disease. We can able to predict. Like that, the accurate clinical history in terms of the kala, that will be helpful in predicting the accurate diagnosis of the disease. Further, prognosis of the disease, we can able to analyze. Hetavaha pura rupani, rupani alpani yasya cha, na cha tulya guno dusho, na doshaha prakritir bhave, na cha kala gunastulyo, na desho durupakramaha, गतिरेकानवत्वं च रोगस्योपद्रवो न च दोषश्चैकः समुत्पत्तौ देहः सर्वौषधक्षमः चतुष्पादोपपत्तिश्च सुखसाध्यस्य लक्षणम्. This is helpful in predicting the sukhasadhyata of the disease. Whereas krichra sadhyata nimitta pururupana rupana madhyame bale kala prakriti dushyana samanyanyatamasya cha garbhini vruddha balana natyupadrava piditam shastraksharagnikrityana manavam krichra deshajam विद्यादेकपथं रोगं नातिपूर्णचतुष्पदं द्विपथं नातिकालं वा कृच्छ्रसाध्यं विदोषजम्. By looking into that, we can able to predict the कृच्छ्रसाध्यता of the disease. शेषत्वादायुषो व्याप्यम् असाध्यं पथ्यसेवया लब्धाल्पसुखमल्पेन हेतुनाशु प्रवर्तकं गम्भीरं बहुधातुस्थं मर्मसन्धिसमाश्रितं नित्यानुशायिनं रोगं दीर्घकालमवस्थं विद्याद्विदोषजम्. That is to predict the yapya vyadhi. प्रत्याख्येयं त्रिदोषजं क्रियापथम् अतिक्रान्तं सर्वमार्गानुसारिणम् औत्सुक्यरति सम्मोह करमिन्द्रियनाशनं दुर्बलस्य सुसंवृद्धं व्याधिं सारिष्टमेव च. This is to predict the pratyakhyayata or asadhyata of the disease. Whereas accurate line of the treatment can also be planned. Suppose if the person is suffering from alpadoshaja vikara, simple langhana may be sufficient. Or if the person is having the bahudoshaja vikara, then we have to go for the samshodhana line of treatment along with samshamana as well as appropriate ahara and vihara. In that way, accurate line of the treatment can be planned if you know about the kala of the disease manifestation in terms of the rutu or in terms of the age of an individual or in terms of the what do you say that the clinical progression of the symptoms in an individual. As far as the description, significance of kala is concerned, it is being mentioned in the Dalhana commentary. If the person is having the disease which is considered to be present in Sarva Rutu, all 6 Rutus, and if the disease is considered to be present for more than 1 year, then such type of the diseases are considered to be asadhya in nature. Mahabala. If the disease is having the Mahabala, in the sense that Roga Bala is more than the Rogi Bala, then such type of the disease is considered to be asadhya. Rog Uttarottara Dhatu involvement. If there is affliction of Uttarottara Dhatu, so that is Rasa, Rakta, Mamsa, Medha, etc., all the seven dhatus are afflicted, then such type of the diseases are considered to be asadhya. Further, it is mentioned in the context of Ardita, Trivarsham. If the Ardita is present for more than 3 years, then such type of Ardita is considered to be asadhya. Further, in the context of the Ashtanga Hridaya and the Charaka Samhita Nidana Sthana, that is being mentioned, Naktam Dinartha Bhuktam Shai Vyadhikalo Yatha Balakala Vishesha Punarvyadhina Mrutvaho Ratra Ahara Kala Vidhi Viniyato Bhavanti. In a sense, by noting about the accurate time of the onset in terms of the time or in terms of the diurnal variation or in terms of the age of an individual or in terms of the rutu of the season or in terms of the whole year as such, then it is very easy to plan the appropriate line of treatment. This is the significance of Kala. To sum up, Sankalayati Sukadukabhyam Bhutani Yojayati iti va Kalaha. Kalayati Sanshipati iti Kalaha. Athava Kalayati Mrityu Samipam Nayati iti va Kalaha. If the Kala is uniting the living beings with either Sukha or Dukkha, Sukha and Dukkha, or the factor which brings the living beings towards their death, then that is considered to be Kala. They are of two categories, Nityaga and Avastika. Nityaga is mainly related to the seasonal variations, that is Vasanta, Grishma, Varsha, Sharad, Hemanta and Shishira. Whereas Avastika is of two categories, Balyadi and Dvararambhadi Avastha. Balyadi in the sense the childhood, Kapha dosha dominance, middle age, Pitta dosha dominance, elderly age, Vata dosha dominance. Whereas Jvaradi Arambhavastha, whether the disease is in the Sanchaya or Prakopa or Prasara or Sthana Samshaya, Vyakta or Bheda. When you think about the significance of the Kala, it is actually helpful in the diagnosis of the disease, what may be the possible dosha dominance, what may be the Roga Marga afflicted, etc. It may be helpful in predicting the prognosis of the disease, whether the disease is either Sukha Sadhya or Krichar Sadhya or Yapya or Pratyakheya, and to plan the appropriate line of treatment, whether the individual is suitable to either Samshodhana treatment or Samshamana treatment or simple Ahara or Achara may be helpful in correcting the dosha imbalance that can be predicted. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. What is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.